Hello, welcome to my YouTube channel. We will talk about in this video 7 types of bleeding that should be considered while pregnant. Your body goes through a series of changes when you are pregnant. One of them is that your period will stop. So, if you bleed in like this, it could push you to panic. There are many reasons you may experience bleeding while pregnant, but some can be serious. It's not unusual to have some bleeding while pregnant. However, you should consult your doctor to get yourself and your baby to safe side, even if you are bleeding very less. Before the video starts, please like this video and subscribe to my channel. Here are 7 reasons you might experience bleeding while pregnant. Having sex. Bleeding after sexual intercourse is one of the most common causes of bleeding during pregnancy. It's completely harmless, and the increased blood flow results from the softening of the cervix. Although this type of bleeding is not serious, you should not hesitate to ask your doctor. Fibroids inside or outside the uterus are tissue masses that can cause bleeding. These tissues may be symptomatic or non-symptomatic during pregnancy. Pregnancy hormones can cause fibroids to shrink or grow. It is best to treat fibroids before pregnancy because in the worst case they can cause ectopic pregnancy, heavy bleeding, or pregnancy loss. However, many women are also able to give birth without any problem. If you have fibroids, please get an examination before getting pregnant. Implantation bleeding. Fertilized egg can cause some bleeding. When a fertilized egg attaches to the uterus, it may cause a slight stain. It usually takes 1 or 2 days. They are not pregnant or menstruate when they encounter this bleeding. Ejection bleeding. Bleeding may occur at about 4 to 12 weeks of pregnancy. This bleeding is usually accompanied by back pain, cramps, and a severe sensation in the pelvis. Your feelings are just like your period. Pregnant women experience this bleeding in their menstrual periods. However, during pregnancy, hormones prevent menstrual period. Sometimes, hormone levels are not high enough to stop your period yet. Then, the result is bleeding. It can take up to 3 months, after which the placenta begins to assume hormone production from the ovaries. Miscarriage. There are times when bleeding is a serious problem and urgent care is needed. Research shows that most of the miscarriages occurs 3rd month of pregnancy. Abortion is usually the result of a damaged baby. Once you reach the 14th-16th week line, you can be sure that your pregnancy is safe. Common symptoms of miscarriage include bleeding, cramping, back pain, stomach pain. However, you should consult a doctor to secure yourself. Bleeding in ectopic pregnancy. Ectopic pregnancy occurs when the fetus is implanted outside the uterus, mostly in the fallopian tubes. You may experience severe pain on one side of your abdomen, pelvic, or general pain that bothers you. This is an emergency situation. Ectopic pregnancy may break the fallopian tube and cause internal bleeding and tube damage. With today's early diagnosis and treatment methods, ectopic pregnancy can be diagnosed without causing internal bleeding, yet it can be treated without injections. Even if you don't have any risk factors for having an ectopic pregnancy, you should examine to your doctor from the earliest period of your pregnancy. Bleeding in placenta. We will make a detailed video about this topic, but we can talk a little about this. What is placenta previa? Sometimes the placenta doesn't grow in the right place. Bleeding can happen at any time during pregnancy. Placenta previa can cause bleeding late in pregnancy. This means after about 20 weeks, which can cause painless vaginal bleeding. This placenta is called placenta previa and occurs in about 0.5% of pregnancies. When the placenta is attached close to the opening of the uterus or cervix, it's called placenta previa. There are 3 types of placenta previa: total, partial, or marginal placenta previa. So avoid this risk. This may recur to bed rest, induction, or G-section if the placenta remains on the cervix during the remaining weeks of pregnancy. So don't worry, we will make a video about this topic. Thanks for watching my video. If you like this video, please like the video and subscribe to my YouTube channel. See you in the next video. Bye bye.